Namaste, everyone. Thank you, Dr. Jindal, and thank you for everyone here for inviting me today. So as Dr. Jindal had mentioned, I'm going to be speaking today about metabolic syndrome. So to start off, today's agenda and the points that I will be speaking about today include what is metabolic syndrome and why does it matter? What are some of the risk factors to look out for metabolic syndrome? And how can we prevent this problem? I'll also touch briefly on treatment options available. So just a little bit about me, because I'm new to this community. I did my internal medicine residency training at McMaster, Ontario, and I did a fellowship in endocrinology and metabolism from Western in London, Ontario. I then went on to do 6 months of extra training in bariatric surgery and obesity medicine, and that's where my interest in this topic actually comes from. I'm currently working at an endocrinology clinic in Oakville, Ontario, and I also work at the bariatric surgery and weight management clinic in Hamilton. So to start off, what is metabolic syndrome? So the easiest way to look at this is metabolic syndrome is basically a group of medical problems that all end up having a risk factor for the same two things. And those two things are an increased risk of heart disease and an increased risk of type 2 diabetes. So what are these medical problems that are involved in metabolic syndrome? You need to have 3 of the 5 following things. A high level of triglycerides, and those are high levels of non-cholesterol fat in the blood, low levels of good cholesterol, that's known as HDL, high blood pressure, high blood sugars, or an increase in waist size. Now, it's important to know that if you're on medications for high blood sugars or diabetes, or medications for high blood pressure, you would actually still qualify for one of these characteristics of metabolic syndrome. The other interesting thing to note is one of the characteristics is increased waist size. Notice that it's not just increased weight. And this is very purposefully done because the circumference around our waist is actually directly a risk factor for heart disease and type 2 diabetes. So you will often see that your family doctor or other doctors are measuring your waist around your navel to determine how big your waist size is. Unfortunately for South Asians, this risk is a little bit higher than the general population. So for the average Caucasian male, the waist size should be less than 102 centimeters. But in fact, for Asian males, the waist size should be less than 90 centimeters. And similarly for women, for the South Asian community, the waist size should be less than 80 centimeters. So how common is metabolic syndrome? It is actually very, very common. In Canada and in fact in North America, about 1 in 5 people, adults, are diagnosed with this problem. And 40% of patients above the age of 65, in fact, have metabolic syndrome. What are the risks? So when I look at risks, I think of modifiable risks and non-modifiable risks. So what this means is, what are the risks that we have, and what can we change versus what can't we change? So to start off with, what are the non-modifiable risks? The risks that we have just by birth and genetics. So age is absolutely a risk for metabolic syndrome. Definitely as we age, we are at increased risk of all the 5 underlying medical problems related to metabolic syndrome. Genetics is a common one, so that's what we pass down from our generations in our families. And there have been over 20 genes that have been associated with different problems related to metabolic syndrome. Ethnicity is an interesting point, especially in our South Asian community. High blood pressure, high blood sugars, and high cholesterol are all diagnosed at an earlier age and at a lower weight than the regular general population. So this is something that in our society is something that's very common and we are at high risk for. But what I would actually like to focus on is the modifiable risk factors. And that's what I'm going to try and gear my conversation towards is what can we change and how can we prevent this? So the most specific risk factor for metabolic syndrome is an increase in weight. So about 50% of Canadians are either overweight or have obesity. This is something that's a growing problem all over the world, and it's even a growing problem in our children. So very important to think about and try and prevent. The other important thing to note is 60% of patients who have obesity actually have metabolic syndrome. So these two things are very much related. I wanted to touch just briefly on how we define obesity, how we define weight in the medical community and as a general population. So we use a calculation called the body mass index, or BMI, and that is a criteria that we use that compares your weight and your height. This is just a simple way for us to help determine what weight category you are in and how much at risk you are of metabolic syndrome and a lot of medical complications related to weight. So a normal BMI is between 20 and 25. An overweight BMI is between 25 and 30, and obesity is a BMI above 30. So naturally, as you move along the classifications, your risk factors for metabolic syndrome, for high blood pressure, high cholesterol, and diabetes increase with the class of BMI. This is something that you may want to ask your family doctor to help you calculate, or there are lots of actually calculators online that are able to give you this information. The other modifiable risk factor for metabolic syndrome is actually smoking. So smoking can absolutely increase your risk of high blood pressure, high cholesterol. Little physical activity or low amounts of physical activity is also directly related. So how do you know if you're at risk? So as Dr. Jindal had appropriately mentioned, most patients above the age of 65 have at least one of the criteria of metabolic syndrome. This is something that I would encourage you to ask your family doctor to screen you for once a year above the age of 65, specifically a blood test for cholesterol as well as diabetes, measuring your waist circumference and your blood pressure. So if you would know that you are at risk if your BMI is in the overweight category or in the obesity category. The other interesting thing to know is even if you're at a normal weight or a normal BMI, but your waist circumference is above the cutoff, this actually puts you at risk. And a way to know whether you are at a higher risk than the average person is looking at your overall body shape. So we characterize this as an apple shape versus a pear shape. And South Asians, unfortunately, are more commonly an apple shape. The apple shape is basically characterized by more fat deposition above and below the midline versus pear shape, which is fat collection below the midline. The apple shape puts you at a bit of a higher risk of diabetes, cholesterol, and blood sugar. Other people that maybe are at risk are patients that have a normal weight but have had a significant weight gain. So this is a group of people that may be at higher risk of metabolic syndrome. And also, most people feel that they have great dietary habits and that they are quite active, but they can still be at risk. So how can we prevent this problem? Number one thing that we can all do is eat a little bit more healthy. So especially if your BMI or your weight fall into the overweight or obesity category, a target weight loss of about 5 to 10% can decrease your risk of either getting metabolic syndrome, so preventing this problem, or improving a lot of the medical issues related to metabolic syndrome. So a reduction in about 5 to 10% of your weight can improve diabetes, improve blood sugars, improve blood pressure and cholesterol, and also increasing your physical activity. Now, I would absolutely encourage you to speak with your doctor, your physician, before making any dramatic changes to your lifestyle, especially if you have underlying medical issues or are on certain medications, because they may need to be adjusted or you may need to have counseling around them. So what I'm going to begin to talk about is eating well and eating healthy. There's a simple food guide called Canada's Food Guide, and I have brought a few pamphlets with me on the way out if you'd like to grab one, describing healthy choices that the Canada's Food Guide recommends. Basically, they allow you to visualize your plate and help to determine what a healthy meal is. Your plate should consist of 50% vegetables and fruit. I would encourage you to have more vegetables than fruit because fruit tends to be high in sugars. 25% of your plate should be grain products, so this is breads and rice, and the other 25 should be protein and alternatives. And I'll go into a little bit more depth about these individual things. The other thing that I wanted to touch on is calories. So this is something that we hear often. Certain foods are high in calories, certain foods are low in calories. But what does this actually mean, and how can you actually use this in your day-to-day? So a calorie is a unit of energy. All foods are made up of energy, and your body has to break down calories or energy in order to use them to have day-to-day function. So for all of your cells in your body, all of your muscles in your body, they need energy to work, and this energy comes from food. If you, however, take in too many calories or too much food, and you don't burn those calories by doing activity or exercise, then these calories are stored in your body as fat, and you end up gaining weight. So that's why knowing how many calories are in your food is very important to determining how many calories you actually need and how active you need to be in order to burn those calories and prevent weight gain. The average target calorie for this age group, depending on your activity, is for men about 2,000 to 2,400 calories per day, and for women, on average about 1,800 to 2,200 calories per day. If you are a more active person, then you will need more calories to maintain your nutrition, and if you are a less active person, you will need less calories to maintain your day-to-day nutrition. I have a few tips for healthy eating that you can hopefully integrate into your day-to-day lives. One is eating at regular times. So oftentimes if we have large gaps in between our meals, we are very, very hungry and we have uncontrolled amount of eating. This often leads to overeating, and oftentimes what's happening in your stomach doesn't necessarily come to your head, and you're unsure as to how many calories you've actually consumed at each of those meals. One of the ways to avoid this is planning your meals. So if you know that you're going to be away for a long time throughout the day, either pack your meals with you or know about a place to stop or where you're going to be eating for your next meal so that you can have controlled consumption throughout the day. Another great thing that we often do is cooking at home. So it's very difficult to know how many calories or what the ingredients or nutritional value is in foods when we eat outside that is already prepared. When you're preparing your meals at home, you often know where the ingredients came from and you know how much of which you're using. The other thing I wanted to emphasize was thinking about calories. So I mentioned calories in have to equal calories out in order for you to not gain weight. One of the easy ways to determine how many calories is in what you're eating is there are calorie counters available. These are some online tools that often have great ways of determining actually what the nutritional value is in what you're eating. One of the ones that I would recommend is called MyFitnessPal. It's a free app and a free online tool where you can type in what you're eating. You can see how many calories, how much fat, cholesterol, and nutrition is in all of your meals. And they actually have a great selection of Indian food, I find. So I think it's a neat tool to use if you are comfortable with using a computer. If you're not, the dietitian is a great resource. So if you do have diabetes or pre-diabetes, your doctor can refer you to the Diabetes Education Center where there's a dietitian who can help create meal plans and help determine what your calorie target should be. On average, if you are planning a weight loss plan, you have to think about reducing the number of calories that you're taking in by about 500 calories per day to lose 1 to 2 pounds a week. This is just an easy calculation that we use if you are planning a weight loss plan, but I would definitely speak with either your family doctor or a dietitian before starting a plan like this. Other helpful tips. So one of the things that I find we do less and less is mindful eating. We're often eating in front of a TV, or we're not necessarily looking at our food or even thinking about how our food tastes anymore. This is something that can absolutely lead to overeating, and it's a habit that we should try and not instill in our children. The other thing that's a helpful tip is using smaller plates. So oftentimes we feel like we have to take enough food to fill our entire plate before our stomach will be happy. But in fact, if you take a smaller plate, you'll end up eating less calories with the same amount of nutrition, and your stomach and your brain will all be happy. One thing that I find that most people know now, but some don't, is the amount of sugar in juices and pop or cola is extremely high. So there's about 8 tablespoons of sugar in 1 can of Coke. That is more than you should be consuming throughout the whole day. So just be careful when you're drinking juices and Coke to make sure you know the nutritional value in it. The other thing to remember is to stop eating once you're full. This is something that we definitely don't do. We stop eating once our plate is empty. So just try and think, am I full? Am I hungry? Do I need to continue to eat? Do I need that second serving? The last tip is eat your favorite foods last. This is a great way to feel satisfied at the end of the meal, not feel like you need to go for a second serving because you've eaten your favorite food at the end and you feel like your meal is done. I wanted to just get a sense in the room, or just to start having you think about calories. So I posed this question to you. This is sort of an average meal that we often have in our households. How many calories do you think is in this meal? So I'll just go through it. These are all homemade items. The meal consists of 2 homemade rotis, 1 cup of homemade mixed dal, and 1 cup of homemade cauliflower and potato sabzi. So how many people think the answer is A, about 320 calories?
No.
Okay. How about B, 420 calories? So some people think B? No? Okay, how about we use hands? How many people think B? Okay. How many people think C, 520? So about the same. And how many people think D? So that's majority. So majority of people think that there's about 620 calories in this meal. And most, you're pretty close. So there's about 520 calories. Of course, this is going to vary from home to home, depending on oil. What's that?
How big is the roti?
Yeah, exactly. Butter, oil, all the ingredients. But I just wanted to get everyone to start thinking about how many calories am I actually eating? How many calories do I actually need? So when I break it down, on average, 2 rotis are about 160 calories and 6 grams of protein. 1 cup of mixed dal is about 260 calories, but pretty good source of protein, so 20 grams of protein. And aloo gobi sabzi is about 100 calories with 3 grams of protein. So just trying to get you introduced to the concept of our foods. One more question here. Which do you think has more calories? So we have a popular fast food sandwich. Yeah, I don't want to say the name. A vegetarian sandwich on the right-hand side. And this is actually homemade dosa with potato filling. So how many people think it's the vegetarian sandwich that has more calories? And how many people think the dosa has more calories? Okay, great. So the Subway sandwich has about 660 calories, which is a lot. That's for a 6-inch vegetarian sandwich. This sandwich has the regular Subway cheese in it and mayo, but it's quite a high number of calories, and it has about 22 grams of fat, so a lot of the calories are coming from fat, and 20 grams of protein, versus a homemade dosa is actually 405 calories, 11 grams of fat, and 3 grams of protein. So,
लेकिन इसको अगर हाफ खाएंगे ना तो हाफ कैलोरी जाएंगे.
yes, for sure, but that's probably not enough for your full nutrition, right? So it's just important to know, we often think something is healthy for us and it may not be, but it's important to know if we're going to prevent diseases that we know we're at high risk for, the time is to start now about thinking about the things that we're eating. I'm going to touch just briefly on protein because I think this is an area that, especially with being vegetarian, is something that we don't meet our requirements for. And protein is something that is very, very important in our dietary intake because it's used in every single cell of our body. It is used for hormones, for tissues, for muscle, and it is very important overall. The other thing from a weight maintenance component is when you eat protein, your body has to work harder to break down that protein versus a carbohydrate or a fat. So protein is actually better because your body has to work harder to break it down than other forms of nutrients like carbohydrates, which are broken down very easily, and fats. Protein also keeps you full for longer. So most of us don't get protein with every single meal, especially being vegetarian. We often have lentils or dal with dinner, but not necessarily with breakfast or lunch. It's important to try and think about protein options for every single meal so that you're feeling full throughout the day. Other things that proteins do is help increase your metabolism. So that helps your body burn calories even when you're sitting completely still. What are some good options for proteins? Great vegetarian options are tofu, quinoa, lentils, and eggs. Something that we don't often do or we shy away from is dairy products because we've often been told that dairy products are high in fat. But this is actually an excellent source of protein for vegetarians. So lower fat dairy products like cheeses and milks are great sources of protein to have and easy to integrate into your diet. And Greek yogurt is something that's actually extremely high in protein and very low in fat and calories. So if you're looking for an easy way to supplement protein into your day-to-day diet, I would definitely encourage Greek yogurt as an easy sort of substitute to get your protein. The target for protein for an average adult is about 1 gram per kilogram. So for an average 70 kilogram male, you want to have about 70 grams of protein per day. One last thing about nutrition labels, I find that this is very confusing. There are tons of numbers here, and it's very difficult to know what these numbers mean. So I wanted to point out 3 specific things on nutrition labels that will make it easier for you to understand the foods that you're eating. The first thing is serving size. This is a big point for things like crackers or chips. Oftentimes the serving size will be 5 chips or 10 chips, and that's not often the amount that we consume. So you have to look at the serving size and multiply all of the numbers, especially the calories, by how much you're actually taking. So for this, the serving size is 2 slices. If you have 1, you'll divide everything in half, and if you have 4, you'll have to multiply everything into 2. Another good point to realize is the fat content. So these percentages, the percent daily value, is actually very helpful. If something is less than 5%, then it's considered a low-fat item. So you only have to really remember the number 5% to try and get an idea as to how good this product is from a fat perspective. And same thing with sodium or salt. So salt is very important from a blood pressure perspective. You're often told to decrease the amount of salt in your diet because of blood pressure issues. Something that would be considered low salt is if this percentage daily value is, again, less than 5%. So 5 is the key number when you're looking at nutrition labels to see whether this is a good choice food or not. I'm going to move on to exercise or activity. The guidelines for exercise or increasing your activity is about 150 minutes per week of exercise. And this exercise is quantified as moderate to vigorous intensity exercise. So unfortunately, going for a walk is usually not enough to add to the minutes throughout the week, but take it slowly and sort of see how much your body allows you to do. A good way to know whether you're doing moderate or vigorous intensity exercise is to see whether your breathing and your heart rate has increased. An easy way that I tend to tell my patients is you should be able to talk, but you shouldn't be able to necessarily sing. So if you're able to sing, you're not working hard enough. But if you aren't able to talk, you're probably pushing yourself a little bit too hard. That's sort of an easy way to think about whether you're doing enough activity. Swimming, bicycling, jogging, these are great ways of doing moderate to vigorous intensity activity. Another thing that we often don't talk about is resistance exercises or muscle strengthening. This is extremely important for posture and for balance, so to prevent falls in the future. Ways to increase muscle strengthening can be through lifting weights, through yoga, or resistance exercises. So even, for example, if you're doing a stationary bicycle, if you can increase the level to add some resistance or pressure against you, this will automatically help with muscle building and strengthening. Again, always ask your doctor before starting any of these things just to make sure that you're being safe. Lastly, just a few tips when it comes to exercises. Find something that you enjoy. Don't make it work. Make it something that you enjoy and gives you happiness throughout the day, because that'll encourage you to definitely do it. You can make it a social activity, so find a friend or a family member that should also be up and walking and being more active, and try and do it in a group setting. That will help encourage as many people as possible. Increase your goal every week. So if you're just starting out and you've gotten the okay from your doctor, start off with 10 minutes. Increase it to 12 minutes or 13 minutes the next week, and then increase it to 15 minutes the week after. That way you're always pushing yourself and pushing your body. An easy thing that I always say is stairs. So we have escalators and elevators and lots of fancy technology that do a lot of the work for us, but as a result, we're getting bigger and we're putting ourselves at greater risk. So anytime that you only need to climb 1 or 2 flights of stairs and you're able to, I would encourage you to climb stairs instead of using the elevator, or park a little bit farther. So if you're getting groceries or going to the mall, don't try and pick the closest parking spot to the door. Try and pick one that's a little bit farther away, and you'll automatically have increased the number of steps you do. Briefly touching on treatment options. So I think first and foremost is going to be lifestyle. So improving your diet, increasing your activity can absolutely prevent metabolic syndrome and in fact treat metabolic syndrome. So oftentimes with weight loss or weight reduction, you're able to come off your blood pressure medications or reduce your diabetes medications just by changing the dietary and lifestyle component. However, oftentimes, inevitably, we do need medications to help with, for example, cholesterol, blood sugars, or blood pressure. And this is something that you'll be chatting with your family doctor about, but it is important to know that there are many different medications and many different ways to treat all of the different issues related to metabolic syndrome. So that's all I had for my talk today. I wanted to point you to a few resources that have great dietary tips and healthy resource tips. One is Canada's Food Guide, so there's some pamphlets at the end there if you want to grab some, as well as a website on there for resources. The Canadian Diabetes Association has a patient portal that has lots of tips on nutritional habits and how to pick healthy choices. And the Public Health Agency of Canada has great tips on exercise, actually. So there are great resources on the internet for more information about any of this. And I think that's it, yeah.